Welcome back to Psychology of Addiction. I know that family systems, that's a form of therapy it's used and it's been shown to be very effective, but are there any others that you really find to be the most effective when you're treating substance abuse issues?
One of the things I'd look at is I don't think substance abuse or chemical dependence is a single issue. I think you have to really look at the particular problem that's going on, and you have to decide, do you have a chemical dependence issue that's coming from self-medicating a underlying psychiatric disorder? Is it a primary genetic problem, such as alcoholism? You still treat it in many of the same ways, but if you don't really get in and find out exactly what's happening, then there's a real problem. One of the things that I did in the middle 80s is I moonlighted by going ahead and doing some DUI classes. One of the things that was really interesting is that I would talk about the hallucinogens and, what kind of symptoms, and then I'd talk about the stimulants. And at the very tail end, I'd mention ADD and Ritalin for about 5 minutes. And we'd take a break, and invariably 3 or 4 people would come up and say, I think I have that ADD. And one day I needed some CEUs, and I went to a conference by Dr. Daniel Amen. And he looks at ADD and the 7 different types of ADD and has brain scans showing the different types. And fascinating. It's just like fingerprints for conditions, every condition, not just ADD. I kept talking to these people, and they had been in and out of treatment facilities for years and really weren't getting better, which can happen, but it seemed to me that they were really dealing with ADD. So I went to a psychiatrist friend of mine, and I asked him if he'd be willing to take a risk and take hardcore alcoholics and amphetamine addicts and screen them and put them on Ritalin. And he was willing to do it. Well, traditional treatment at that time, it was if you went to AA, you had about a 60% success rate. And if you went to outpatient therapy or inpatient therapy, you had about a 60% success rate. And if you did both, you had an 80. We had a 95% success rate. And what that means is they got stabilized on the Ritalin if they really had ADD. They stopped all the alcohol and drugs almost immediately and didn't go up on the Ritalin. So what that made me think about is the whole idea of homeostasis, okay? So one of the things that happens is if you are allergic to sugar, most people think of allergies as you get blood pressure problems or you get a rash or something like that. Actually, what happens often is people crave more sugar. So they continue eating it. And a lot of people develop an eating disorder based on that, binging. And you would think of that as an addiction. And I think it is. But it's based on an allergy. So if you don't realize that and try to treat it the regular way, you're going to fail. If you identify exactly why somebody is acting in an addictive fashion, whether it's an emotional thing or like a divorce for a couple of years and somebody's going wild, or whether there's alcoholism riddled in the family, or whether there's ADD in you, just specify there, you get a lot better results.
I think it really ties into the disease model and the medical model where it explains addiction as that all the behaviors and the repeated patterns of use is actually a symptom of an underlying chemical imbalance.
Right. And there's lots of different kinds of chemical imbalance, but if you find out exactly what it is and you take care of it, you're in good shape. Because the interesting thing is that the body is incredibly intelligent. It's a lot more intelligent than the conscious mind, but it's intelligent short term. So Once I was out playing golf here in Arizona in the middle of summer. It was like 122 degrees, but since I was born here, I didn't really register. But I came back home and I started to drink a whole bunch of water. And then I found some Fritos and I started gobbling the Fritos. And after about a third of the bag, I realized, I'm trying to get salt and water into my body, and I could have had a salt tab and some water and been fine. So my body knew what it needed, but probably Fritos is not the primary solution to that.
Well, you probably had the Fritos a little closer than the salt tab, right?
Yes.
Well, that's all for now, but join us next time and we'll be delving into more information.